When rescuing hurts. When you are a caretaker for a loved one and they're getting care, psychiatric care, you will want to rescue them or save them from their pain or from what they're going through. And that desire to rescue them comes from deep love, deep concern for your loved one. But it's problematic when you are the rescuer role, because it can lead to more problems and delayed care. And so we're going to talk about what does it mean to be a rescuer and what to do to address it so that you can end the cycle in your family dynamic. So rescuing is when you want to rescue your loved one. And it can be when you feel desperate to end the pain and suffering of your loved one because you're so worried for them. You'll do anything to make them feel better. Seeing them in distress makes you feel distressed, and you want to stop it by any means. You feel that you are the only one that can save them. So some signs that you are a rescuer is if things often feel like an emergency, where you have to fix things now. They're struggling, it's an emergency. Nothing ever feels good enough for your loved ones. And that can lead you to change providers frequently. This is a concept we call doctor shopping, where you switch providers because you want quicker results or things just never feel adequate enough, and it leads you to change care frequently. You feel a need for control over your loved one and their care. And that's a fear response, because wanting to control is a way to appease fear, because you don't really know what's going to happen, or you want to limit unpredictability. You have to know what's going on at all times with your loved one. That can lead to frequent calls, check-ins, or not even really wanting your loved one to be away from you, to always be under the same roof or within a close distance. And most of your time is spent worrying or thinking about your loved one and their illness. And it can even become an obsession because you're so concerned for them. And you lose touch with concern for yourself and your own needs. You feel like you're the only expert in their care. Most of your decisions are made out of fear, and that leads you to become very reactive or reactionary. You are quick to blame others whenever your loved one is suffering, because seeing them suffer is so painful and distressing to you, and you need to find a reason behind it. And you blame someone and you need to fix it right away. You feel guilty or like you're failing if you don't jump in to remove suffering, because that's your role. You find yourself making excuses for why they can't do something. And this can show up a couple different ways in psychiatric care. The first is when you find yourself explaining away or excusing why they are acting a certain way and communicating in a way where they don't really need to do something about it because of this disability or this diagnosis. The other way we see this is you create reasons for them not to commit to difficult change or to practicing new habits or learning skills because they're so sick or they're so disabled that they can't do it. And you start explaining why they can't make those changes. And that's problematic. Why is this a problem? So the first is that fear is running the show. Everything becomes about your fear for them or fear of fear itself. And when fear is running the show, you are in fight or flight. And when you're in fight or flight, you're not using your logical brain. That's science. And you won't make wise decisions. You're going to make impulsive ones. So when you're acting in fear, additionally, your insight isn't good to determining what is actually an emergency or not. And therefore, everything is an emergency. And you don't have good insight into prioritizing or triaging what actually needs to be addressed first, as opposed to what can be paused, maybe addressed later, based on what's going on. The other problem is that you're afraid of discomfort, especially discomfort that your loved one may be going through. And when you're afraid of discomfort, that can lead you to have a quick reflex to run away when discomfort happens. So when avoiding discomfort is your motivation, you're going to miss out on healing. because the healing process is uncomfortable. It's not sunshine and roses. It's not linear either, where you're progressively getting better. It's messy. It's challenging. There's lots of painful emotions involved in healing. That's expected. That's normal. But you can't be afraid of that discomfort, because then you're going to stop too early. Just like the physical therapist who needs to help you stretch and get mobility after some kind of injury, that process is annoying and it's painful and it's not always necessarily pain relieving, but it's necessary in order to gain your functionality back. Another helpful example is CPR. So when someone's going through cardiac arrest, they need to go through CPR. And CPR is really traumatic on the body. Many times providers will actually fracture or break the ribs of the patient because they have to push so hard to keep that heart pumping. There's lots of vomiting that can happen, and the actual shock process is very hard on the body. And it can be quite painful if someone actually becomes alert and oriented during that process. That's a necessary pain, though, to help revive this person, to help them heal. And as a result, if you're afraid of that painful process, you'll miss out on something life-saving. And to take that further home, many times providers will actually have the family leave when they're receiving CPR in the hospital, because the family's presence there is not helpful in any way for a couple of reasons. First, it's really painful and traumatic and emotional to witness that happen to your loved one, that they have to go through the necessary pain of that life-saving treatment. But more so, it's also distracting to the providers if the loved ones are there. If they are hysterical or crying or having lots of emotions about it, if they try to intervene in any way or try to give demands, they need to step away and let the professionals do their job, because the nurses, the techs, the doctors, they know what to do. They have that treatment training down. The family's presence there isn't useful in any way for the patient, for the family, for the providers. The family can get involved afterwards in the aftercare with knowing how to manage meds, lifestyle changes for the patient, next steps. That's useful. But during that crisis intervention, not useful. So in the psychiatric setting, what's the negative impact of rescuing? The first is that your loved one stays sick. If your loved one is always being saved and rescued and gets used to that, they learn that you're always going to be there to make things better. And they don't ever really have to learn the lessons to thrive, to deal with stress or pain or how to cope, because you're always there. And so they will learn to become dependent on you, and they will stay sick because they get the comfort of you always being there as long as they are sick and needy and disabled. You also avoid getting real treatment, because if you are abandoning ship or leaving early whenever there's discomfort or fear or unknown, you're never going to fully commit to the healing process, because there's going to be lots of unknowns and discomfort, and you'll miss out on the real healing. You're modeling unhealthy behavior. Even if you're not a parent in this scenario, you are still modeling for your loved one what healthy behavior is. Like, they will imitate what you do because they look up to you, whether or not they say it. And they're going to learn from your behavior to stop doing things whenever things are too difficult, and never really learn distress tolerance. They'll learn that doctor shopping, that let's just change it around or switch things up because we don't like it. They're going to learn that mentality from you and repeat it. You're perpetuating the fear cycle. So if you and your loved ones get stuck in that cycle of reacting whenever you're experiencing fear or discomfort, they learn that they don't need to follow through as long as you feel afraid. And it can actually become manipulation. Whether or not it's conscious or intended, manipulation can happen, where if you are afraid, they get to escape. And they can feed on that fear that you have and never really learn the hard work of change. If you feel afraid, they're gonna get to leave. They're gonna get to change it up or abandon the care. You get stuck in that cycle. You guys both deserve better. This is a terrible place to be. You're in constant fear and crisis and discomfort and guilt and shame, and no one is having emotions that are being coped with. There's no skills being learned. You guys both deserve better. Caretakers, you deserve to have a life that is separate from your loved one. Even if they are a big part of your life and you truly are providing for them in some way, you still are allowed to have a life that is separate from them, where you get to meet your own needs and practice your own self-care and be your own whole person separate from them. And you also deserve to have your anxiety to be dealt with so that you're not reacting to it and that's not feeding everything you do. Patients deserve to learn independently, to learn that autonomy, to learn those life skills that are necessary, and to have the freedom to do so without someone helicoptering or hovering or monitoring them at all times. They deserve to cope and learn how to cope with their emotions, get those coping skills, and to learn how to still be successful in life, even when life is painful. And they got to learn that on their own without someone constantly being there. So loved ones, don't get in the way of that process. You have to learn how to step away. It's like the family's got to get out of the way when CPR is being done. So what does that look like? How do you get out of the way? What are some practical ways? The first is through setting boundaries. There's so many ways to talk about boundaries. In this setting, we're going to understand it as a way that you are separate from others, your loved ones in this case. There are a lot of boundaries that can be set. We'll focus on a few. The first are time and space boundaries. So you need to let go of needing to monitor every detail of their care, communicating constantly with them, or constantly needing to be near them. Residential is actually a great opportunity for loved ones to experience reprieve because you finally don't have to be there all the time. The patient is getting 24-hour full-time care with multiple clinicians, constant monitoring. They are safe. They're in a safe environment. They may be uncomfortable. They may not like it. That's okay. Doesn't mean they're not safe. And that means that you get to focus on you and have some space away from them and some time away from constantly worrying about them. Like, this is your chance. Can you take that opportunity and own it for yourself and let go of that monitoring rescuer role? Emotional boundaries are big. We're going to focus mostly on this. One ways that you need to set emotional boundaries with your loved one is separating what is their responsibility from your responsibility, because they are not the same. So your loved one, they are responsible for their own emotions, for their own skills, and learning how to use them. That is not your responsibility to cope for them, to remove any stressors from their life, or to prevent pain in their life. That's not your responsibility. Your responsibility as a loved one is to cope with your own emotions and to focus on you. So don't jump in and take on their responsibility for them. Set that boundary, because otherwise they'll never learn it unless it's expected from them. Another emotional boundary is you need to accept that they will experience some form of emotional pain. It's expected. It's okay. Life is painful. That's okay. It doesn't have to be your pain, though. They can feel afraid or angry or helpless. And most of the time they'll have many of those emotions when they start residential, like not really something people enjoy doing or they look forward to doing. That's okay. You don't have to be angry, anxious, and helpless just because they are too. You can feel hopeful or relieved or encouraged or whatever positive emotion you want to have, even though they're feeling those emotions. Like, those can be separate. And when you keep it separate, when you're not taking on their emotions as your own, you're more likely to be objective and actually a positive support for them, because you're not reacting as much when it's not your own emotion. You're able to be more stable and centered. You're also allowed to have a good day when your loved one's having a bad day. And they're going to have a lot of bad days coming up because they're going through a lot. you're allowed to experience joy and pleasure and happiness, and you don't have to feel guilty for those things. Like, you're allowed to have your own emotions separate from them, and that doesn't make you a bad mom or a bad family member or a bad friend. It just means that you're different and you're separate from them, and that's healthy. But as far as emotional boundaries go, you will have bad days too. You're going to experience a lot of emotions as a caretaker. You're going to feel a lot of sadness, helplessness, guilt, fear. You're going to feel a lot of really overwhelming negative emotions. That's okay. We expect that, but we also expect that you need to cope with them instead of reacting to them. That also helps you stay objective. Keeping it separate, where you're not owning their emotions as your own. And also when you cope with your emotions, that helps you stay objective. And so coping with them requires you to be aware of what you're feeling and really owning up to that, what you're feeling, and doing something about it in a healthy way. And that's an emotional boundary where you're creating limits for what your emotions dictate, where you're not letting your emotions dictate what you do and how you react. And that will help you make wiser decisions. Those are just some boundaries. Compassion without boundaries is actually selfish. So if you don't learn boundaries, your compassion toward other people will become about you. It will become about how you feel more appeased when you help them, about how you are taking care of your fear and your guilt when you're helping them. And it's more about your own emotions and making sure that you don't feel them. So that's why you're going to help them. Because ultimately, when your loved one is suffering, it makes you feel things and you can't deal with that. So that's what you become obsessed with fixing. So it becomes about you. It's selfish. When you have healthy boundaries, you get to have compassion where it's not about how you feel about it. It's just about what's best for your loved one. And sometimes that means something really loving and caring and tender. Sometimes what's best for them is like tough love, hard truth, saying, I know this is hard, but I still expect you to do this. And you're able to make those decisions when you have boundaries, and it's still compassionate. It's still loving. So the first intervention is boundaries, like we mentioned. The second is radical acceptance. Radical acceptance is hard, so essential though. So radical acceptance is your surrender to life's terms. So the first is accept that you can't control your loved one's illness. And for some of you, that may seem obvious, but really ask yourself, when you do things, do you feel really desperate? Are you grasping for control over your loved one in some way that you don't have control over? Are you really afraid of the unknowns and doing things to try and appease that? That's you trying to take control when you just don't have that control. And accepting that reality will actually allow for more freedom and embracing the process. You need to accept that healing is a process and it's a painful one. So healing is a process, meaning it takes time. Please stop looking for a quick fix. It's not going to be one. It won't be lasting. It will be false if you think you see a quick fix. This is normally years of undoing that we're working through. And habits take weeks to apply, sometimes months. And you can't base if you're making the right decision on how quickly you see results. That's just not going to be a reliable measurement. So you have to accept it's a process. And your loved ones, you also need to accept they have strengths, capabilities, and skills within them that they're learning. And it takes a long time to figure those out and to learn how to use them. Will you give them the space to do so? Even though they don't ask for that space, will you still give that to them so that they can learn what's really inside of them, what they're capable of, so that they can have a more autonomous and independent life and a successful life? Can you allow that process to take place without getting in the way? And then can you accept that it's a painful one, that change is hard and learning new skills, new routines is difficult, and negative, overwhelming, big emotions are going to come up during this process, and that's expected That's normal, and that's not a reason to stop. Can you accept that? Can you accept the pain that may be there, and not react to it? And radical acceptance means that you need to stop trying to be the expert. Accept that you are not that expert role. You're not the psychiatrist, you're not the therapist, the counselor, the nutritionist, or whatever that role is. Even if that's your career, you are not that role for your loved one. Your insight is automatically impaired when it comes to your loved ones. There is a reason why hospital policies prevent people from treating or operating on loved ones, family members, spouses, because insight is poor. That's just the way it is. So just accept that. Your insight's going to be poor with your loved one. You don't need to be their provider. Advocating for them is important. We welcome that, but that doesn't mean that you become the provider or the expert role. That's different. And then your loved one, they do need to learn how to become the pilot. Becoming the pilot is important. Solstice is a co-pilot. That's a big emphasis. But that means your loved one's learning it, not you, the rescuer, becoming the pilot. Your loved one needs to learn that autonomous role. And them learning that role is also a process of them getting some professional guidance on taking ownership of that. And we help facilitate that learning. So can you accept that it's a partnership? Can you partner with the provider instead of trying to become or do their job for them? Is that something you can do? Can you step back? Can you take that back seat? That's radical acceptance. Now, this is difficult to do, especially if it's new. Boundary setting, radical acceptance. But clearly the current system isn't working, right? Something does need to change. And remember, the definition of insanity, according to Einstein, is doing the same thing over and over again and expecting different results. So this cycle needs to change. It's time to do something different. And the more that you play that rescuer, caretaker role where you're always jumping in, you won't see different results. You'll see the same patterns repeating themselves. And as you break away from this, there's a couple things to remember. First, rescuing is an addiction. It is an addictive process. The anxious thoughts that come with rescuing become habits. And it's painful to stop acting on it. You can even experience withdrawal as a result of stopping the rescuing. You'll feel horrible panic, shame, fear, guilt, whatever that may be. And you're going to want to relapse, so to speak, or you want to jump in because you are so used to that cycle. And the more you are aware of that, the more helpful it is, but also the more you start taking care of yourself and coping with your emotions and focusing on filling your cup, the easier it'll be to break away from it, and it will get better. Rescuer roles are also an identity issue. The rescuer role does become your identity. So you can experience an identity crisis when you step away from rescuing. You will actually feel like you're abandoning yourself and abandoning your family. And again, it does come down to taking care of yourself, being aware of your own needs, meeting them, coping with your emotions, like allowing yourself the freedom to take care of you and to find you again. That does help it, but this will happen. That doesn't mean it's wrong. It doesn't mean that you're truly abandoning your family. It just feels that way. So just being aware of that feeling that will happen, that's expected. It's common and it will get better, but don't react to the identity crisis and the withdrawals that'll happen. They just need to be coped with. Because again, we need to break the cycle, break the insanity that's happening where you're expecting different results. So caretakers, please don't hesitate to get your own help because this is a difficult change for a lot of you where you're stepping away from the rescuer role and learning boundaries and learning how to accept life on life's terms and learning how to cope with your own emotions. That's not easy. A lot of people do get stuck, and many times it does require getting professional help to guide through that. It's very practical learning that needs to happen. And you're not above this, right? You can get help too. And it's time to start addressing it. So if you need your own therapist, your own counselor, to deal with this. We'll make that recommendation if we see it as well. But if your instincts are there, like, this is something that's really painful for you, get that help. Because you don't want to be the reason why your loved one stays sick or doesn't get help. Because rescuing always hurts. Rescuing gets in their way. So you want to learn, how can you step out of their way and help your loved one truly get the healing they need?